Immunotherapy has been a new exciting addition to the treatment of cancer as a whole. Melanoma is probably the disease area where immunotherapy has been studied for a long time and where the immune checkpoint inhibitors have been in use for a few years. In lung cancer, this is the first time we've had an immune checkpoint inhibitor or any agent that modulates the immune system approved. So we're in early days and early experiences about how these drugs work in lung cancer patients. There are some important differences we need to keep in mind between melanoma patients and lung cancer patients. Lung cancer patients tend to be older. They tend to have more concomitant medical illnesses like diabetes, hypertension, vascular problems, whereas melanoma patients as a whole are more fitter and younger. So they are able to tolerate some of these therapies better compared to lung cancer patients. The second thing to keep in mind is in melanoma, combination immunotherapy is given now. Agents that target CTLA-4 and agents that target PD-1 or PD-L1 are given as combination therapy. In lung cancer, while these combinations are still being studied, they're not available for routine use. So the agents that we give are the PD-1 or PD-L1 inhibitors, which by themselves are not as difficult to tolerate as some of the combinations can be. So these agents tend to have lower incidence of adverse events. So those are some of the differences to think about when you look at melanoma and immunotherapy versus lung cancer and immunotherapy.